Hello, my name is Dr. David Yoder, and today's topic is vagus nerve treatment and research and what I've brought into my practice. So I'd like to take us on a little journey of a personal story. During the pandemic, my wife was going through breast cancer treatment, and one of the unfortunate side effects of chemotherapy can be chemo brain or like brain fog. And so I wanted to help minimize that possible side effect. Since it was during the pandemic, the second challenge I had was a lot of my patients were no longer interested in musculoskeletal or chiropractic care, but they were more concerned with the effects of the COVID virus. So between my wife and all of my patients in my community, the number one priority was supporting the immune system and how to support that in a non-invasive way. So through my research, I discovered that vagus nerve stimulation helps modulate what's called the inflammatory cytokine storm that can damage the brain in acute COVID or long COVID, as well as side effects from inflammation from chemotherapy. So with this handheld device, we are developing what's called Electroceuticals. So we've all heard of pharmaceuticals, drug therapy for treatments, as well as nutraceuticals using nutrition and herbs to treat patients. And this is the newest frontier in medicine called Electroceuticals. So literally this little device delivers a frequency and energy medicine to my patients. And I'm happy to say my wife never got chemo brain, and a lot of my patients through the pandemic had minimum side effects from the virus and help recover from acute COVID or long COVID. This device also is now emergency authorized to address and treat long COVID. It is FDA approved for treating migraine headaches, and as a doctor of chiropractic, I've used it for other conditions from trauma to PTSD, anxiety, insomnia, gastric function, arthritis in the joints, as well as helping people sleep better.